to get a little bit of connection of who you are, your history, the work that you're doing in homeopathy, the work that you've been doing in India.
Okay. I finished 4 years of studying homeopathy, full-time course, and I did 6 years of medical doctor, and I did my MD with specialty in oncology. And then just last year, I did my PhD in oncology. And since last 36 years, I'm integrating homeopathy in the modern medicine. So I'm attached to many hospitals in and around Bombay, and I run a department of homeopathy. And now since last about 7 to 8 years, I have also started a department of integrated cancer department in modern medicine. So this is the kind of work I do. And I had a huge experience in treating critically emergency, very severe pathological cases, handling them in intensive care unit with homeopathy. So this is my specialty. I'm adding all my clinical information of modern medicine into the synthesis repertoire. So most of this information related to advanced pathology in a rubric form are all my addition. Plus I have studied Jungian psychology. So a lot of psychological rubrics, and I integrate Jungian philosophy in case taking Jungian philosophy in understanding materia medica. So that's my another specialty. So this is what I am.
So your work is really groundbreaking in a lot of ways. And I would like to first touch the point on oncology. What is it that first got you interested in pursuing a career in oncology?
In fact, I never wanted to become a doctor to begin with. It all was an accident. I was always fascinated to become an engine driver in railways. You know, I wanted to drive an engine, and I was about to take an admission in an engineering line. But because some of my very close friends went to the medical line, so I said, then I'll be left all alone if I study engineering. So I
No
just followed
kidding. Wow.
I just follow the trend, something like that.
Yeah, well, thank
And
goodness you did.
and then yeah, and then once you enter the medical school, then you don't feel like coming out, because then you are with your friends.
Right.
So it was a fun. And after that, I got married. I had 2 daughters, and then after my birth of my second daughter, there was a seat available in the city of Jaipur, not in Bombay, to do this MD course with oncology. And so I appeared for the entrance examination, and I got selected. And I spent 3.5 years in Jaipur and did my study. At that time, the field of oncology had very little reference to homeopathy. And so maybe that was the big challenge for me to identify whether homeopathy can really work in cancer patients. Let's put it that way. So I had just work of Grimmer and Lippi on my table, more of Grimmer's work and little bit of Burnett's work, but very scattered information. And I wanted to apply them clinically and find out its efficacy. So that's why I used to do it in a very small way, in personal way, I would rather say. But then when I joined, yeah, please
And
tell
in
me.
a personal way, you say.
Yeah,
Yeah.
personal way in this means my private patients. But then when
Okay.
I joined the PhD course, it was a big, big challenge, because for years I was denied to do PhD using homeopathic medicine.
Ah,
Because the allopathic lobby is extremely strong, and then medico-legal problems. And it was a tough, tough, tough thing, and I had to fight it out. They didn't recognize me. They didn't recognize homeopathy. They wanted proofs and studies as a background information. And then there were no studies available in the research department, or no studies available anywhere in the world related to cancer. So they said, okay, what we can do is we give you 20 patients. We observe you for 3 months. You work on our protocols, scientific international protocols, and if you don't achieve something in that protocol, you are out. So that's how I accepted to work with homeopathy and protocols, because modern medicine does not accept that patient feels better. If you say like that, modern medicine will say, okay, give me at least 3 protocols which you have used as a criteria to say that patient is better. And so that's how the scientificity came. And then gradually every alternate year, I started presenting my paper in World Congress on Cancer.
Wow.
And there also, there was a lot of opposition in the to begin with, but later on, I presented about 3 papers in a span of about 6 years regarding homeopathy and cancer. But my main focus in all these 3 papers was the pain management, how to manage the cancer pain, because I am not right now taking too many things on my head. Because if I can convince my seniors, if I can convince my hospital people that homeopathy really helps cancer patient as far as pain is concerned, then I think so they will give me more and more support. So next year there is a 4th World Congress in Boston where I'll be coming, and at that time maybe I'll meet you also personally.
Would be
And
wonderful.
yeah, and so that's I'm just working very hard for that paper so that it gets selected, because selection is also a tough job. They issue about 7,000 papers from all over the world, and they only select 130 papers.
Wow.
So I have to really work very hard for that paper to get it selected. So in this department of homeopathy that I run in hospital, we do very, very scientific work as far as cancer is concerned, and not just simply taking a case, giving a remedy. Patient says, I'm feeling much better, looking at the report. No, that's not the one which we do. We do a very detailed scientific study, because that helps us to as a case module for the future research in world congresses. So I'm working purely from that angle. But in my own private practice, of course, I treat lots of terminally ill cancer patients. I treat lot of them.
Hmm.
So
So
about
tell me,
60% practice is my cancer patient as per today.
60%.
Yes, because the rest I work in hospital. So I treat very advanced cases like pneumonia and severe infections, kidney failures, cardiomyopathies. So for me to treat cough and cold and skin allergy is not very big.
Yeah.
But
Wow.
before, in my earlier years, I did a lot of pediatrics. So that's why I wrote many books on pediatrics. I wrote books on lack remedies. So that was one phase where I was with Jungian psychology, pediatrics, fairy tales, and all those things. But after doing my PhD, my whole practice has changed topsy-turvy. And now I am only looking most of the time oncology cases.
Mhm. Now, what percentage of your oncology patients are using conventional care as well?
Almost, almost
Almost all.
all. To begin with, when I joined the hospital, I was only allowed to see a person who is A, terminally ill, B, he should be on minimum 60 grams of morphine sulfate. Now, 60 grams of morphine sulfate is a very big dose, because then nobody is going to give me a cakewalk in such a hospital. You follow? Nobody believes in homeopathy. Nobody has faith in homeopathy. So only those cases where nothing much can be, offered,
Right.
such cases are given to me. So still in hospital, I am not allowed to treat anybody individually with homeopathy. But if the patient refuses that, look, I don't want radiation, I don't want chemotherapy, and he signs the paper, then of course I can treat them with homeopathy. But in my private practice, I would say 5% to 10% of patients are there with me who have never taken anything in their therapy, and they are purely on homeopathy, but the percentage is very small.
Wow.
Yeah, only 5 to 10%.
So tell us about when you were first starting in the hospital, when you were able to use homeopathy and they were giving you like the patients that they were expecting no outcome with anyway.
Yes.
What was your experience like with those patients using homeopathy, and how did that lead to, the
You know,
hospital continuing to allow you to use homeopathy?
so my whole practice was trial and error to begin with, because I had no books on my table, as I said, no repertory on my table which gives you experiences like that. So it was purely using an allopathic information, you follow,
Hmm.
into homeopathy. So let's give a very simple example. So let's say somebody is having a pain and it's a spasmodic pain, let's say. Now we all know that atropine is used for in allopathy for spasmodic pain. So what I did was, we have a belladonna, correct, which has atropine inside.
Yes.
So I started experimenting in various potencies of belladonna. And after maybe 30, 40 cases, I found out that belladonna 3C acts the best in
Three.
cancer patients. 3,
3C.
3C.
Okay.
So now I use a lot of belladonna 3C whenever I see spasmodic pain. The best part is that all these terminally ill cancer patients who are on morphine sulfate basically will not give you modalities, basically will not give you concomitants, basically will not give you peculiar cure rare symptoms as Hahnemann states in Organon. It's a different practice totally. You have to change the whole Organon and sit in front of the patient. If you are expecting a very, very classical approach in front of a terminally ill cancer patient, maybe you will have a lot of disappointments, which I had it. Because the patient is so drowsy, he's hardly able to talk about himself. Forget the pain. Sometimes you ask his age and he will think for 2 minutes how old he is. Now,
Wow.
with such a patient, if you are going to ask him his characteristic modality and dreams and cravings and desires, because cancer patients don't have an appetite to begin with, what desire and aversion they are going to have?
Yeah.
If yeah. So it's a very different practice. It's a very different case taking approach. So what we do is basically trial and error, because if you're going to ask them, a cancer patient terminally ill with pain, what makes your pain worse? And he will say, when the action of morphine is over, my pain comes. What gives you relief? If I take morphine, I feel better.
Right.
Now this is the answer you will get.
Right.
So you have to innovate some new things, which I am doing it every day in my practice, and I'm trying to find out what kind of remedy really helps cancer patients. So most of them is a palliation, 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 palliation. And once we palliate the pain, then we palliate something else till a stage comes when he is able to give me some proper classical homeopathic information. Once I get that, then it is a very easy for me to select a constitutional homeopathic remedy and then take the case further. This is what I do.
That's phenomenal. And in that work, when you're working with people, how long on average does it take you to get from the palliative work that you do with homeopathy to finally being able to do some more of that
Okay.
constitutional work?
So most of them die during that process because
Oh,
I start only very late. You know that.
right.
It's my problem. So most of them die and they don't reach to that stage. But in hospital practice, maybe 20 to 25% people reach to that stage. But in my private practice, I don't see such terminally ill patients. I
Okay.
see them in a much, much better condition.
Yes.
And that is why I would say 70% in my private practice come to that stage where I can give a constitutional treatment.